When we talk about education in Africa, we mostly refer to examination results, technology, infrastructure, and access to education itself. But there is also an equally important part of education that I feel we are neglecting, and that is mental health. Because sometimes a child could be absent, or rather, could be present physically in the classroom but absent minded. It could be due to emotional struggles, depression, anxiety, isolation, or even simply being overwhelmed by being present in an environment he or she is not familiar with. And Nigeria provides a good case study for this growing challenge, and also shows that school is also definitely a part of the solution when it comes to mental health challenges. Research paints a clearer view of this challenge because a 2026 study that was carried out across schools, public secondary schools in Lagos, involving adolescents aged 11 to 17 years of age, showed that about 38.2% of the adolescents involved had at least an internalized disorder, be it anxiety or depression. And we still had 4.5% of these adolescents had both depression and anxiety. And it is crazy because most of the times in Africa, we see this as not an African problem, but an Oyibo problem. Also, within adolescents that have major depression, 38.1% met criteria for major anxiety. So it is concerning because adolescents, let's say people that have major depression and anxiety, are 10 times more likely to commit suicide because they'll be having suicidal thoughts as compared to those that don't have this comorbidity. So it's actually a big concern in our educational system because the sad part is that behind these statistics is not just numbers, but a young child who is trying to pass his or her studies, make a living for him or herself, build their future, and make their families proud. So this is a major concern when it comes to our educational system. So what contributes to mental health challenges among students? There is no one particular answer to this, but there are a significant level of factors that can actually contribute to this because it could be academic challenges. Students write exams, family expectations, there are competitions, and even fear of failure. But this is not just restricted to this because the Lagos State study showed that also exposure to domestic violence. We also have isolation, and also parental alcohol use also lead a lot of students to anxiety and depression. Not forgetting bullying, difficult family circumstances, financial hardships. Also, a lack of a safe space to discuss emotional problems can actually make things worse. And also the factor of stigma, where a lot of students fear to communicate how they feel for the fear of being judged or not being understood and probably being mocked for speaking out. So these are some of the reasons or some of the factors that can actually contribute to mental health challenges in students in secondary school. This is why mental health cannot be treated separately from education because the school is one environment that is easy or is one environment where early warning signs can be actually noted, maybe changes in the child's behavior, attendance, and then changes in academic performance of the said child involved. So these are some of the things that can actually be done within the school environment, and it could help curb things before they get out of hand. But also teachers need help in terms of training so that they'll be able to identify warning signs and identify them early enough and also know when to refer these cases to qualified professionals who will be able to help the child better. Actually, a study was carried out which involved approximately 3,000 students and 294 teachers across 21 schools in the southwest region of Nigeria. And after the program is a depression literacy program, and after the program, it was observed that students also improved in terms of confidence, attitude, and knowledge. So also their teachers also improved in knowledge and confidence on how to help students when such cases arise. It simply shows that mental health education is actually very important and can make a difference, especially when those involved, in this case, in the academic environment, in school environment, the teachers and the students are well equipped with the knowledge and skills concerning issues of such nature.